All right, how's it going everyone today? Today we're going to do IV cannulation, which is basically just accessing the vein for one of three reasons. Fluid administration for someone who's dehydrated, med administration for someone who needs medications for an emergency, or drawing blood to figure out what's going on with the patient, okay? Now, this is important for you guys because at some point, hopefully not soon, in your lifetime you'll end up in an ER and someone's going to probably give you an IV. And I think an informed patient is a better patient, and participating in your medical care is really important, and knowing what's going on can help protect you in case someone has an error or someone does something that's not right, okay? Also, so if you walk into an ER, okay, someone's going to come up to you and potentially go, hey, we want to start an IV on you. And if you have any questions, that's a really great time to go, why? Okay? That's your right. It's a good idea because it's important to know what's going on, okay? And it'll probably be for one of those three reasons, okay? So the first thing we're going to do is I'm going to set up my equipment, okay? I've kind of already done that here. So the important thing, most important one, is the needle with the catheter, okay? Got our saline lock, okay? That gives us a little extra extension from the skin so that we don't pull the IV out or mess it up, okay? We've got our blood tubes for collecting different samples to test for different things. We've got our saline flush, okay, that lets us flush the blood back in once we're done drawing blood. And this is our Luer lock. This has a little needle in there that goes through the rubber of the blood tube and lets us draw blood from the catheter, or from the saline lock. This is our chlorhexidine wipe, so it's really important to cleanse the area and decontaminate, get rid of any bacteria that might be on it, because we don't want to put that in the vein. Okay, and this is our tourniquet, okay? So the first thing I do after I set up all my equipment is I apply the tourniquet. What that does is it stops the blood in the vein from going forward and it backfills it. And that plumps the vein up so you can see it easier. So once I put that on, I can kind of make my choice as to where to go. Okay, and depending on what your medical needs are, it kind of depends on, or it can influence where I go. If you are really dehydrated or you need medicine fast, or you're actively dying, we're going to need a big needle and a big vein. If not, we have a little bit more room to work with, and the patient's and your choice matters. So if you go, I don't like it there because I like to, bend my arm or it feels weird, and it's not super needed, but we're going to do it anyway, or we're going to, give you medicine, then I can choose to do something down here if there's veins to work with. So I put the tourniquet on, I look for my vein, I set up all my equipment, and once I pick what I'm going to do, that's when I so I get my catheter out here, okay, well, set that aside right there. Make sure I clean it really good here with chlorhexidine. If someone doesn't clean the vein and they're about to poke you, you can stop them and go, hey, can you clean that? And they'll go, yeah, absolutely, sorry. So that's an important thing. Also gloves, make sure they're wearing gloves. All right, so once you clean the area, you're wearing gloves, take out your needle. I'm going to cannulate the watermelon here instead of my vein, less painful. So I like to do a 30 to 45 degree angle. Depending on the depth of the vein can depend on the angle, and that's okay. If it's really shallow, you do a shallow angle. So I go in, make sure I stabilize, because depending on the vein, it can move. So stabilize, I insert in. And then, so there's a little thing in here called a flash chamber. I go until I see blood in there, okay? It's a negative pressure chamber that once it enters the vein, it backfills in there. And so if I get blood in there, I know I'm in the vein. And there's a little difference between the end of the needle and the catheter itself. So I need to lower my angle. I need to advance all the way in so I get that straw in there too. Once I do that, then I advance the catheter all the way flush with the skin. And there's a little spring in here, so I just press that button and it retracts the needle. So now there's just a flexible plastic straw in the vein. Okay. Now, depending on which kind of catheter I use, depends on whether I hold tension or not, because we have self-tamponading ones that prevents backflow, but some of them don't, so I have to stop any blood from flowing out of the vein so we don't make a mess, and frankly, we don't waste your blood. So once I do that, then I can attach my saline lock to the catheter right there. Okay, and usually I secure it with a tegaderm right there. That makes sure it doesn't pull out. Then I attach my Luer lock, and then I can draw bloods right off that. Okay, and I usually just draw bloods right off the bat, even if I don't necessarily need them right away, because later sometimes docs add on stuff. So if someone draws blood and you go, why are you drawing blood for this? That's why, just in case. Sometimes they order tests after the fact. So once I draw all my blood, then I take my saline lock, I hook it up right there, and then I flush the blood back in the vein. And I make a salty watermelon. Then I tape it off right there. And then we can use that again for drawing blood or giving meds or giving fluids later, okay? And that can be in there for several days, honestly. And then, if you need to get admitted, that'll stay in, okay? Any questions? I think that's it. All right, that was better.
Yeah, thanks, man.
All right.
Nice.
All
What was
right.
the watermelon? What was the time?
5:40.
Can you title this huge salty watermelon?